Analyzing risk factors for abandoned prescriptions. UPMC Matilda Theiss Health Center is a primary care facility treating approximately 1,600 medically underserved and sometimes uninsured patients. They offer services including child and adult physical examinations, chronic disease screening, and medication dispensing services. Clinical pharmacy services are provided through their contract pharmacy coordinated care network. Matilda Theiss is a federally qualified health center. FQHCs qualify for enhanced reimbursements for Medicare and Medicaid and qualify for the 340B drug pricing program. This allows the facility to receive medications at a heavily reduced cost, giving Matilda Theiss the opportunity to provide affordable health care to the underserved in the local community. A large problem currently facing Matilda Theiss is prescription abandonment. The issue occurs when a medication is prescribed and filled, but the patient fails to retrieve it at the pharmacy. Many factors can contribute to abandonment, from new FDA regulations that require greater transparency regarding side effects, to high medication prices, to a simple lack of communication between the care facility and its patients. Prescription abandonment is particularly a problem in economically disadvantaged communities where other essential purchases may be made in lieu of medications. Matilda Theiss is currently operating at an average loss of $10,000 per month as a result of several operational and financial factors. Our group's focus is on the role that e-prescriptions have in this financial loss. With the help of the Matilda Theiss team, we have identified several contributing factors. One such factor is abandoned prescriptions. This refers to medications that sit in Matilda Theiss's inventory unclaimed and are subsequently sent back to CCN to be disposed of. For these prescriptions, Matilda Theiss sees no reimbursement, eating the cost of the medication's dispensing fee and the medication itself. Another factor is unclaimed prescriptions. These are filled medications that sit in the health center's pharmacy for over 2 weeks after delivery. Such prescriptions create excess inventory, leading to major disorganization in an already cramped pharmacy. Finally, there's a lack of communication between patients, the clinic, and coordinated care network. When abandonment occurs, Matilda Theiss and their contract pharmacy do not effectively share information, which can lead to confusion and dispensing errors.
The first step to understanding the problem was talking to the pharmacists and doctors who could give the best guess as to what factors contribute to prescription abandonment and how we could help the facility. Using this information, the team created an inventory system that captured information about prescriptions currently in the system and how they flow in and out of the facility. This was done by taking inventory of all prescriptions on the shelves and establishing a system to capture prescription flow via patient pickups, daily deliveries, or even if it never left the inventory. The relevant information collected helped quantify the number of prescriptions moving throughout the clinic and determine if factors of interest were contributing to prescription abandonment with statistical significance. To determine if the capacity existed for pharmacists to fill extra prescriptions, a work study was conducted to help determine how time is spent by the pharmacists. This was accomplished by checking the pharmacist's current task at random times throughout a 2-week period. Using the prescription information collected from the current inventory along with ones picked up by patients, the team created a spreadsheet to analyze abandoned versus picked up prescriptions, distance from the clinic, and the cost of the prescription. Multiple t-tests were run to see if, individually, any of the factors have a statistically significant effect on prescription abandonment, in addition to a 2-way ANOVA to analyze the effect of chronic and acute medications.
After running the risk analysis data through a statistical software package, the results showed that none of the factors we tested had a statistically significant impact on prescription abandonment. Work sampling revealed that pharmacist utilization is very high. Matilda Theiss does not have the capacity to fill more prescriptions in their current system. After performing cost analysis, we determined that only $99 to $264 of Matilda Theiss's $10,000 monthly loss is due to prescription abandonment. The variance in these numbers depends on the fate of unclaimed prescriptions in our study.
In order to help improve the abandoned prescription problem, the project team recommends a few different things. First, implementing a more thorough inventory system would allow for the number of abandoned prescriptions to be determined at any time and see how this changes over time. We recommend that other factors than the ones already looked at be investigated to see if they reveal any correlation with prescription abandonment or if abandonment occurs on a case-by-case basis. Finally, it is recommended that the clinic investigates other pharmacy costs to see if there's any potential areas of improvement that may yield bigger savings than abandoned prescriptions. Throughout the project, it was important to consider various social, environmental, and financial factors. Patient medication cost increases would be unacceptable because many patients of the clinic have a lack of financial means to pay for the medications. To minimize potential environmental harm, emphasis was placed on minimizing the number of abandoned prescriptions which would need to be disposed of. Additionally, decreasing the clinic's prescription costs would help to increase the money available to be invested to provide additional services.